This is an outpatient rehabilitation center. And again, the second floor here where we're located, we specifically see spinal cord injury patients, varying levels, all levels. After I went across and tested out the product, I could see, again, tons of applications. Vibration's been used with therapy for years, but not really on this whole body level. Again, I experienced fatigue in 6-8 minutes, so it was just, I was like, okay, can I apply this with spinal cord injury and facilitate the muscle contractions? As far as the objective outcomes, I guess really it's really almost more case study, anecdotal. But again, they've been such good results as far as spasticity management, muscle facilitation, reducing tone. It's been incredible. And again, we do have it's an outpatient facility, so we've had brain injury, stroke, and some other patients with other therapists come up here and use the vibration, and it's been incredible. Patients with high levels of spasticity and tone, because in 3 to 6 minutes I can reduce unwanted tone. You can see a natural stepping pattern or heel strike, toe off, unclawing of a hand, the dropping of an arm, and again you can go from that unwanted muscle activity to volitional movement, and again 5-6 minutes versus 20 or 30 minutes of passive stretching. It would have to just be an increase in the efficiency of how fast I can get a muscle that's weak or partially paralyzed to respond. And again, if you think of this with spinal cord injury, someone who doesn't really have triceps or has weak triceps, and in a matter of 3 or 4 weeks I've increased 1 or 2 muscle grades their tricep, this is a huge quality of life. Maybe they couldn't transfer, now they're independent in transfers. Again, it's worked well with abdominal contractions for some of the higher cervical level. And if you think of the trunk control and the level of independence that gives somebody in a wheelchair, that's significant. Again, instead of spending 20 minutes stretching or trying to reduce the spasticity, I can come over here, put someone's leg on here, 5-6 minutes of treatment, turn the clonus in the foot or the ankle, almost gone. Slide the orthotic on and go instead of 20 minutes, unwanted tone. You're getting, unwanted movement in the brace, skin breakdown. Again, with some of the people with hands, we can reduce the spasticity, then we'll put them back in the chair, try different hand controls. Again, in 5 or 6 minutes versus 20 or 30 minutes of passive stretching. Currently, there's 2 that are going through the Human Investigation Committee at Wayne State. One of them is going to be looking at just muscle activation and blood flow in individuals, different levels of spinal cord injury, and then hopefully in the near future we'll take that with the implementation of a couple of steroids. And again, looking at muscle growth, muscle hypertrophy, and bone density, which is, as you know, huge with spinal cord injury.